Whether you have a teenager or a newborn, it's always fun at the pediatric visit to find out how much your child has grown. In those first few months, pediatricians like me pay really close attention to a baby's weight because if a baby gains weight, we know they're healthy. They're using their calories to grow. If a baby doesn't gain weight, we worry that they are burning calories because they have something wrong with them. If you've had a baby, you may remember that when you were in the hospital during those first 2 weeks, doctors may have had you worried that your baby had lost weight. In the last episode, we talked about how often parents are recommended to do something called triple feeding. That's a method to both breast and bottle feed to help the baby gain weight. But the truth is, weight loss is normal, completely normal and expected. On the last episode, I talked with Shelby Abramson. She's a family nurse practitioner and an international board-certified lactation consultant, and she is back to explain more. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. Shelby Abramson was a nurse on the mother-baby unit and a neonatal intensive care nurse, as well as a mother, and now she's a breastfeeding expert. We talked about what to expect and how to set up for success at breastfeeding in last week's episode. In today's episode, we'll talk about some of the challenges that mothers have with breastfeeding and how to handle them. Let's start with the newborn weight loss. So, is it okay for babies to lose weight in that first week? And should parents worry about that?
Great question. Absolutely. Yes. It's not only okay, it's normal. All babies lose weight after they're born. That is the expectation. We typically say 7 to 10% is normal. And so that's 7 to 10% of the baby's birth weight, however you calculate it, whether that's in pounds and ounces or kilograms. And that nadir, that low point, often happens at about day 3 or 4. And some of the reasons why babies lose weight in the first few days is because they're going from a very wet environment in utero, basically cooking in that amniotic fluid for approximately 9 months typically. And after they're born, they're in a very dry environment. And so some of that is literally evaporative water loss. Babies are starting to make meconium, which is that black sticky poop in the gut, in utero. And then very often that meconium, babies shed it, discard it. They poop it out in the first few days and they don't get it back. So those are a couple of the reasons why we see weight loss. A third is because on that second night, we spoke earlier about milk transitioning, about, formerly bringing that milk in. When mom has colostrum in the breast and baby is working to help that milk transition, oftentimes on that second or third night, baby it seems insatiable. They just have a hugely high suck need that turns on like a light switch. And so I remember from my days in the hospital, all of the parents on the postpartum unit in the first day are telling me, my baby is too sleepy to eat. And then I'd come back and see those same patients the following day or the day after, and they would say, my baby was so hungry, they wouldn't sleep at all. So it's good to try and get some rest on the first day because you should anticipate your baby being up all night on the second or third night, nursing, wanting to suck, helping you to transition that milk. Again, I use the analogy like putting in the order at the restaurant. So they're at the breast and they're putting in that order, removing the colostrum, nursing to help the mature milk come in, helping that colostrum transition to the mature milk. And that burns a lot of calories for the baby. And so that's a third reason why we see weight loss is just, caloric burn. And we mentioned before as well, the benefits of skin to skin. That can help baby stay at a good temperature, help them not burn excess calories, trying to regulate their temperature, regulate their blood sugar. And so we do see weight loss, typically 7 to 10% around day 3 or 4 often. And then the important thing is that we want to see babies start gaining that weight back. And the textbook definition is that they're going to kind of come back to that birth weight between day 10 and 14. They're going to start regaining. Usually with breastfed babies, I see weight gain of anywhere from a half ounce to an ounce a day, 15 to 30 grams typically, as they come back to that birth weight. And certainly in my practice, I work in this niche field of breastfeeding medicine, which I'm so fortunate to do. I often get referred patients who have excess weight loss. It's newborn babies who have lost more than 10%. It's newborn babies who've lost that weight further away from their birth date than day 3 or 4, meaning they haven't kind of turn that curve to come back. And you mentioned triple feeding earlier. It might be a time, like if you had a baby, your newborn baby was born and still wasn't gaining weight by day 5, day 6, that baby might not have the energy to put in the order to help mom's milk supply come up. And so rather than something like triple feeding, which is just so exhausting, perhaps just starting on a little bit of a pump regimen and doing some bottle feeding for baby without the third piece. And so going back to the triple feeding, sometimes what I'll do is I'll switch up the order of a triple feed if it's really necessary, and we're going to do it maybe once or twice in a total of 24 hours. I'll have baby start with the bottle and then come to the breast, because that way they have a little milk in their belly. They're a little more organized. It's like a power bar
An
before
appetizer.
the race. Thank
Yeah.
you. Yes, I love it. An appetizer. And they have a little more energy. They're a little more organized. And what I like about that too is it doesn't set mom up to say, I'm going to do this for 15 minutes and take my baby off the breast so I can get to the next thing in this feeding regimen, because I have to bottle feed, I have to pump. And if baby comes to the breast and even transfers a little bit of milk, they might fall asleep heavy and happy. And to me, that's the reward of breastfeeding. That's what I want parents to remember, to recognize, and what I feel is often the motivator to continue and keep going in these days, which, let's acknowledge, can be really challenging. Can be every parent I have ever come across in my entire life wants to do the best for their infant. Everybody puts a lot on having enough, on making enough, whether that's about breast milk, whether that's about, baby gear, whether that's about love, whether that's about, any number of things.
I see that. All parents want to do the very best for their children. And I think that's why I get questions like this, and I have my take on it. But what's your expert opinion on pacifiers? I think parents get the message that they interfere with breastfeeding.
I feel like pacifiers have, in some circles, gotten a bad rap.
Agree.
And that parents are sometimes afraid to introduce a pacifier or haven't asked or been taught.
They ask me permission all the time at my visits. Is it okay if I give one now?
Exactly.
I love them.
Exactly. So, as you mentioned, babies are born to suck. They're born to have a high suck need. Why? Because that's what helps that mom's milk transition. That's what puts in the queue for more milk. And just like I talked about, some babies who go from those early cues to those late cues really quickly, some babies will have a lower suck need, others with a higher suck need. And so I try to encourage or teach or educate, especially in the first few weeks, that if baby is getting fed well, they're nursing well, they're kind of not losing too much weight, they're eating appropriately, meaning all the time, they are having the good diaper output, that's a great way to know baby is getting enough, right? Because what goes in must come out. So if they're pooing and peeing a storm, that's very good. And if a baby simply has a very high suck need, I think giving them something to suck on, such as a pacifier, a chupon, a passy, what do they call them, like in British slang? A binky, a
Nook.
dummy. a nook.
A dummy. Oh.
So whatever you call it, basically a baby sucking on that is essentially a replacement or a replica of the breast. And what do we know about the breast? It's soothing, it's in mom's arms, it's warm, it is the comfort of a parent. And so I think that for a baby in a car seat, a baby who needs a procedure such as a heel poke for a blood draw or a circumcision, having a pacifier is a great tool to help bring some of that soothing and some of that calmness. I think it's just important to know that pacifiers were invented to replace breasts. So again, I hate that terminology or that wording of like, the baby's just using me as a pacifier or the baby's just using you as a pacifier. We invented pacifiers because they're soothing. And so shouldn't a baby get soothed in a parent's arms? And so pacifiers themselves, I'm happy with. Parents thinking that they're only just a pacifier, I kind of don't like at all.
Do parents need to wake their kids at night to feed? And can they stop? When can they follow the baby's cues?
So typically I want to see babies who are eating 8, 9, 10, 12 times in 24 hours in the first couple of weeks. And once they've come back to their birth weight, if that really kind of happened on the anticipated schedule, then parents don't need to wake their babies at all. The baby will cue and let mom and dad know when they're hungry. And there's some caveat there. Of course, you still need to expect that your baby's typically going to eat every 2, 3, 4 hours for the first month of life. And there isn't a good opportunity, in my opinion, if your goal is to raise a baby who has a healthy digestive system, who's taking appropriate amounts of milk to fill their tank, to stretch it out much beyond that. So anything past 4 or 5 hours, even in the first couple of months, I would say is pretty uncommon. And if you happen to have a baby that's doing that and growing great and really happy, you don't have to advertise that at any of your mom groups because that's not super common. That's not the norm. You don't necessarily need to be bragging about that to your pregnant friends. And I can almost
I
guarantee—
literally said that to somebody yesterday. They told me their baby sleeps 6 hours or 7 hours at night and they're growing great. I said, don't tell any of your friends with 2-month-olds. It's not fair.
Exactly. And who's to say what's going to happen at 4 months with that baby when there's a lot of brain growth and development? Or what's going to happen with that family if they have another baby in a few years? Because sometimes you get a kiddo who I guess I'll call a good sleeper, and then one who needs more attention, needs more nighttime parenting than the first.
Is it true that you can leave breast milk out on the counter, or do you need to be careful about that? People ask a lot about what's safe.
Quite simply, I use the rule of fives: 5 hours on the counter, 5 days in the fridge, 5 months in the freezer for freshly expressed breast milk. And I'd say that those guidelines are fairly conservative, but they're supported by the CDC and they're perhaps a little bit more liberal than you might find in the hospital setting or in a daycare setting. And the difference that I explain to parents isn't that one of us is right and one of us is wrong. It's that in the hospital, there are a lot of germs and there are a lot of babies. And so we don't want to mix up 2 kids' milk. We don't want to contaminate things with somebody who's coming from a different part of the hospital and has a lot of germs on them. So the rules are often more conservative in those kinds of settings. But in the comfort of somebody's home, no, I don't think that the milk has to go right to the fridge. And it's often for parents that are doing some pumping, some medically recommended supplementation for their baby. Not only do I say that the milk can stay out, and I know I'm going to rock some people's minds right now, I tell any parent that has their baby at home with them, they don't need to sterilize anything. I say a soap and water wash of pump parts, and really not even necessarily every single pump session, because somebody who might pump and pump again 2 or 3 hours later could probably leave those pump parts at room temperature. And what we know is that breast milk is amazing. It is filled with antibodies, it is filled with antibacterial, antifungal, antiviral properties in it. And so, not that I would recommend this, but there have been studies where they put breast milk into researchers put breast milk into like a dirty container or into a petri dish with different contaminants, and the breast milk actually like clears the area around that petri dish. So nobody should necessarily feel like they have to get out of bed at 2 in the morning. Any new parent who is pumping at 2 a.m. is already doing a lot. I am totally comfortable with that milk sitting there until the next feed. And oftentimes, that advice and recommendation is met with a little bit of disbelief, but I assure you it is evidence based and totally safe.
Nearly 1 in 3 kids deal with constipation and pooping problems. Their little guts are overwhelmed by factors like poor diets and antibiotic overuse. One of the best ways to help support digestion and their immune system is by adding prebiotics to their daily routine. Did you know that 70 to 80% of our immune cells live in the gut? A happy gut means a healthy kid, and prebiotics help feed and increase good gut bacteria in your kiddo's microbiome. In partnership with nutrition scientists and pediatricians, Begin Health created daily growing up prebiotics. It's the perfect prebiotic with 3 grams of fiber in every serving to support smoother and softer number twos, so potty time is smoother for the whole family. My patients tell me they love this tasteless and textureless powder because it mixes into their kids' favorite drink or food, making it easy to give to even picky eaters. Visit beginhealth.com today and get 25% off your order with my promo code NEXTDOOR, NEXTDOOR. Predictable potty time and the perfect poop is possible with Begin Health Daily Growing Up Prebiotics. Shelby gave you permission to spend less effort washing your bottles and pump parts and to give your baby a pacifier if they'll take one. There are lots of ways to feed a baby. I have a number of patients who prefer to pump and give breast milk from a bottle, and I feel like that is an unnecessary amount of work for myself. But for parents who either don't want to feed at the breast out of convenience and timing, or just need to see how much milk their baby is getting, this is something that parents do. I haven't ever had a mom ask me this question, but I've always wondered if there is a difference in the milk, and Shelby knows the answer to this question too. Is there a difference in the quality of expressed breast milk and feeding at the breast, do you think?
So there's some evidence to talk about sort of this mammary, which would be referring to the breast, and baby's oral salivary pathway. If I were to drink out of this cup that's on my desk with the straw on it, I'm going to leave some saliva here on the straw of the cup. And when a baby makes a vacuum suction at the breast, which is what they do when they're nursing, there's a little bit of transfer of baby's saliva into the breast, of certainly a lot of that breast milk into the baby's mouth. When a baby's nursing at the breast, they're putting in right at the table, right at the dinner table, right there at the breast, they're exposing mom to what they've been exposed to. And so, what we know, and I think this research has come out, just in the last handful of years, is that right there on contact at the level of the breast, mom will start creating antibodies. Her immune system is more mature than a newborn's, and that'll happen right there. So, it can happen in a couple different ways. If I were an exclusively pumping mom, if I were mostly pumping, I might go and, hang out at the daycare center, hang out at the hospital where my baby is, touch those kinds of things, and then breathe them in and, have that interaction. And then my whole body might start to make antibodies and send that through my milk. But in addition, for a baby who's able to do skin to skin, for a baby who's able to do any direct breastfeeding, but also just being held at the breast, just starting those early aspects of breastfeeding, that the mom will make those antibodies right there. And I don't know that we've really looked enough into not only pumped milk, but also milk collected. So, like the
Oh, true. Good
silicone milk
point.
collectors
Hmm.
that have come really, or almost ubiquitous now in popularity on the market, looked at all these different kinds of milk. But if there's one take home message from that, it's that mother's milk is really precious. There are lots and lots of benefits of direct breastfeeding. There are lots and lots of benefits of breast milk. And ultimately, there's lots of ways to feed a baby with love, with a bottle, with a combination of feeding, with formula that also give babies great growth, help them to thrive, help them to be perfect kindergartners and graduate students and, respectable members of our society.
Shelby said that so beautifully. It's true. Breast milk is fantastic. But as far as I know, nobody has ever been asked at a job interview if they were formula or breast milk fed. But plenty of people talk with each other about whether they felt loved growing up. The next issue I see very often in my clinic is having difficulty getting the baby to latch properly. How can we help babies latch well?
Basically, there's a short video. Actually, it might be like 10 or 15 minutes, but I love the first 2 or 3 minutes of it, from the Global Health Media Project. And it's called Attaching Your Baby at the Breast. And she says in the video, in the English version, "It is a common misconception that babies come to the breast and drink from the nipple as though it's a straw, when in fact, babies really need to attach deeply at the breast. It's not just about sucking at the nipple, it's really about stimulating the tissue behind the nipple." So I think about a tube of toothpaste, and I could be squeezing at the end of that tube of toothpaste where the toothpaste comes out all day long. And I'm not going to get a lot of toothpaste out of it. But if I just bring my hand to the back or the bottom of that toothpaste and I just give a little bit of pressure, right? What do we see? We see that toothpaste all over the bathroom counter. And I know that because I have a 6-year-old. So, anyhow, with the toothpaste, it's kind of like the breast. Maybe that's not a great analogy, but if you
That is
just,
a great
oh,
analogy.
okay, great. Then if you
Yes.
just come a little bit further back at the breast where the milk is made, and that's where you're able to apply a little bit of compression, a little bit of pressure. And when I say a little bit, I really mean a very little bit. Something that I think is a very, very, very important tip to know. If this is like my one piece of advice, it is that the breasts are made of delicate glandular tissue. The pectoral muscles are quite deep, so we never need to get into the lactating breast like a deep tissue massage. It's only going to cause problems. It's only going to cause congestion. It's not going to bring relief. And so, whether a parent is trying to express more breast milk, whether a new mom is maybe at day 3 or 4 and they have that milk transitioned, they can see it, they can feel it, the breast is heavy, it's full, the last thing we want to do is press hard on it. It's very, very gentle touch to the lactating breast that's going to be most effective. And so when the baby latches on, they really need to be past the nipple, onto the areola, sometimes even onto the past the areola. Areola, nipples, breasts, they come in every shape, size, color that there is. And so there isn't a clear marker because every woman is different and every breast is different. But the more tissue that the baby has in their mouth, the more comfortable the feed is going to be for the mom, and the more milk the baby is going to get. So it's a win win. And I kind of think of it as Mother Nature's way of cueing us that something isn't great if mom is in a lot of pain, if it feels like her nipples are getting pinched, if baby unlatches and mom's nipples are cracked and bleeding, that's a big red flag because she's uncomfortable and she is definitely an important part of this dynamic and this duo. But also, baby probably wasn't getting milk as efficiently as they could have if they had been latched more deeply. And some of the most simple tips that I have for that are to simply breastfeed skin to skin so you can get baby a little closer. They're not wrapped in pajamas and blankets and mom doesn't have a nursing bra and a pajama top and a robe on. Like, let's just get these two people really close together so that they can get as close together as possible. And you can also use those early cues, that rooting reflex to help baby get on deep. And I'd say one of the biggest things I see and one of the biggest tips that I have is that oftentimes brand new moms are super gentle, super delicate with the baby, and super rough and super firm with the breast. And not that I want it to be a complete reversal, but babies need support, I find, to be brought up and held pretty closely and securely. And the breasts need a lot less pressure and tightness than sometimes we're holding, or let's just get away from massaging lactating breasts. There's nothing good that comes out of that.
Lots of good messages from my talk with Shelby Abramson. And if you take nothing more away, take that message. Let's be gentle with ourselves. If you made it through this entire episode, even if you are not a lactating mom, won't be one, or don't know one, you just learned that the connection between baby and moms is, evolutionarily speaking, one of the most interesting aspects of being a mammal. We didn't talk about this one other aspect, but I talked about it in my interview with an oral myofunctional therapist back in episode 35. In that episode, myofunctional therapist Suzanne Robertson and I talked about thumb sucking, nail biting, snoring, and drooling, and she taught me that breastfeeding is thought to help a baby form the musculature of their mouth and may actually help prevent conditions like sleep apnea later on. If you are a breastfeeding mom or a grandparent looking for more tips on breastfeeding gear, go back and listen to episode 67 when I met with another board-certified lactation consultant. And we talked about the few things you might want to purchase to help support breastfeeding. Thank you, Shelby Abramson, for bringing the science of breastfeeding to help moms have a good experience. Your expertise is really wise. You can find her at Children's Primary Care Medical Group in Southern California. She's got an army of breastfeeding experts in San Diego and Riverside counties to help you. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.